Welcome to your monthly update from the COVIDENCE UK study. My name's Adrian Martineau. I'm the Chief Investigator based here at Queen Mary University of London. And today with me is Giulia Vivaldi, one of the statisticians working on the study, who's going to share with you our latest findings. Giulia, over to you.
Thanks, Adrian. So previously, we have looked at long-term symptoms in people with COVID-19, and we've examined how frequently they occur in people who've had the infection compared with those who haven't. These sorts of long-term symptoms can be a sign of long COVID. In today's webinar, we're going to look at whether people with other respiratory infections also have long-term symptoms and how these compare with long COVID. Our post-acute infection syndromes basically describe the symptoms that people can continue to experience after the acute phase of an infection has passed. So after your body has cleared an infection, some people are still left not feeling back to their normal selves. These syndromes aren't new. Long-term symptoms have been seen in people infected with SARS, MERS, and influenza. And many cases of chronic fatigue syndrome are reported to follow an infection-like episode. Long COVID is another example of this kind of syndrome and considers a wide range of persistent symptoms that might continue or develop after acute COVID-19. And these symptoms aren't restricted to people who had severe disease at the time of infection. Long COVID has been reported in people with mild COVID-19 and even those who were asymptomatic. The problem with post-acute infection syndromes is that they are difficult to diagnose. They can present very differently in different people, and we don't really have diagnostic tests available. And this can lead to people who live with these conditions remaining undiagnosed. But the COVID-19 pandemic has brought a much greater awareness of the potential long-term effects of respiratory infections. And so this leads to the question of whether there are long-term symptoms of other acute respiratory infections that people might be experiencing. So we decided to look at people in the COVIDENCE cohort who reported an acute respiratory infection that wasn't COVID-19. Once again, we're looking at a cross-section of data from January 2021, which is a time when all of our participants were asked questions about potential long-term symptoms. At this point, 472 participants had reported an acute respiratory infection that was not COVID-19, so it was accompanied by a negative COVID test. And we compared the symptoms they had with participants with previous COVID-19 and participants who reported neither infection. We only included people whose infection was more than 4 weeks earlier, so focusing on the long-term effects. And we adjusted for things that might influence these symptoms, such as age, sex, comorbidities, and baseline general health. Now, in all of these participants, we once again looked at a really wide range of symptoms that could potentially indicate long-term effects of infection. When compared with participants who did not report any infection, people who reported a non-COVID-19 acute respiratory infection were more likely to report almost all symptoms considered, except for hair loss, muscle or joint pain, and problems with taste or smell. The greatest differences we observed were for coughing and changes to voice. People with a previous infection were 3 times more likely to report these problems. And the average time since infection in these participants was around 3 months. Now, when compared with participants who had COVID-19, people who reported a non-COVID-19 infection were less likely to report problems with taste or smell, hair loss, and lightheadedness or dizziness. Our analyses also suggested that people with a non-COVID-19 infection might be less likely to report difficulty concentrating and breathlessness, although this did not reach statistical significance. Somewhat unsurprisingly, the biggest difference was for problems with sense of taste or smell. People who had COVID-19 were nearly 20 times more likely to report this problem than people with a non-COVID-19 infection. It's important to note here that there is a big difference in the time since infection in these two groups. Our participants with COVID-19 had, on average, been infected 10 months earlier, so we're talking about really long-term symptoms for them. However, in this analysis, we did adjust for time since infection, which should take into account the potential waning or changing of symptoms over time. All of the comparisons so far have been in all participants presenting with these infections, regardless of how severe their symptoms were. but we also wanted to focus on people who were reporting the worst symptoms. So we looked at the symptom profiles among the most severely affected people in each infection group. Now, to do this, we looked at each group in turn, identified the participants who were experiencing the greatest symptom burden in that group, and then compared their probability of reporting each symptom across the groups. It's important to note that this is a descriptive exercise. We haven't done statistical comparisons here, but by looking at these patterns visually, it can help us to better understand the differences and similarities between these groups. The blue line represents people with no reported infection, and we can see that some symptoms are quite common in this group, such as muscle or joint pain and sleep problems. And having this baseline group helps us to interpret how much worse symptoms might be in people with previous infections. Among these people with a high symptom burden, we can see that people with previous infections of either kind were more likely to report almost all problems, and their symptom profiles are actually quite similar. Among people with previous infections, we can again see differences in hair loss and problems with taste or smell. But we can also see potential differences in memory problems and difficulty concentrating. These might represent the brain fog that many people with long COVID report. In conclusion, we found that people with a non-COVID-19 respiratory infection are more likely to report a wide range of symptoms more than 4 weeks after their infection than people who haven't been infected at all. When compared with people with COVID-19, they were less likely to report hair loss, difficulty concentrating, and problems with taste or smell, as well as possibly dizziness and breathlessness. However, we observed little difference in other symptoms. Importantly, we do not have definitive evidence from this analysis that post-acute symptoms experienced by people with non-COVID-19 respiratory infections have the same duration as long COVID. On average, our participants with other respiratory infections had been infected around 3 months earlier, whereas our participants with COVID-19 had been infected about 10 months earlier. But either way, 3 months is still a long time to live with symptoms. The next steps will be to look at post-acute symptoms for non-COVID-19 infections over the longer term. And we'll also want to explore symptom trajectories and determinants of recovery in people experiencing long-term symptoms after either kind of respiratory infection.
Thank you very much for that, Giulia. Really, really clear explanation of some very important data. And hearing that talk really brought home to me, I think, a few things. One is the importance of the longitudinal data we collect. The second is the importance of people reporting data on illnesses other than COVID-19 and even reporting when they're well. Because if we didn't have that data, then we wouldn't be able to make these comparisons that you've reported on today. So I think I just want to close really by emphasising the value of people's ongoing commitment to the monthly questionnaire, which we really appreciate, and the importance of completing that questionnaire even when we haven't had COVID-19. We've had another infection or indeed no infection at all, because that's really what gives this cohort one of its unique values. So thanks, Giulia, for all your work on doing the analysis and the presentation. Thanks to all of you watching for your continued participation in the study, and we look forward to seeing you next month. Goodbye.